The needle slid between ribs at the fifth intercostal space 30 degrees toward the left shoulder. A steady hand held it there. Dark blood climbed the barrel of the syringe. The monitor screamed, then found a rhythm. Beep, beep, steady. A thin surgical scar crossed the wrist that held the hub straight as a ruler. 6 hours earlier, the doors at Bayview Trauma Center parted at 1:47 p.m. Baltimore air gave way to antiseptic and burnt coffee. Fluorescence washed the lobby in tired light. Ava Collins walked in wearing navy scrubs that hung a little loose at the shoulders. Stainless steel mug badge clipped to her hip, no bag. She signed in at the nurse's station with small exact handwriting and said nothing more than her name. The afternoon hum sat low in the building. Carts clattered. An elevator chimed somewhere down the hall. Dr. Richard Kane stood at the surgical board with 2 residents, hands behind his back, like he was inspecting a formation. He was silver at the temples and carried himself as if gravity bent around him. Ava moved behind him to pull a chart. He glanced over his shoulder without turning. "Coffee station is that way." The resident smirked. One of them, Miles, covered a laugh with his knuckles. Ava met Kane's eyes for a beat, unreadable, then nodded and walked to the prep area. Dr. Nina Patel, senior resident, with a tired posture and clear gaze, saw the exchange over the rim of her cup. Her pen stopped mid-note, then started again. At 2:15 p.m., Ava got the assignment for OR3, laparoscopic appendectomy, 31 low fever, elevated white count, textbook. Kane would lead. In the prep bay, instruments appeared on the tray in a quiet order. Scalpel, trocars, graspers, clamps, retractors. Ava lined them by size and sequence angles, parallel handles pointing the same way, as if she trusted geometry more than luck. The patient was draped by 2:35. The smell of betadine and warm plastic hung in the air. Kane entered gloved and confident. He nodded to anesthesia and made the first incision. Ava had the scalpel in his palm before he asked, then the retractor, then suction. His gaze flicked up. "How did you know I needed suction?" "Standard progression, doctor." He grunted and kept going. Deeper into the abdomen, the camera showed pink that leaned a shade wrong. Ava saw a pale yellow cast around the cecum and a shimmer that should not have been there. A smell crept under the layer of cleaning solution, faintly sour, like meat turned in a sealed room. Vitals stayed steady on the screen. Temp elevated, but not wild. Kane dissected with an efficient rhythm. "Doctor," Ava said, "the discoloration near the cecum. There is a smell. We should consider expanding imaging before we proceed." Kane did not look up. "Nurse Collins?" "Yes. I have performed this procedure for 20 years. The appendix is inflamed and intact. Vitals are stable. Your job is to assist, not diagnose." Miles coughed into his mask. Ava kept the suction where he needed it. "Understood." 30 seconds later, as Kane retracted the appendix, a pocket of cloudy fluid emptied into the cavity. The smell hit. Not imagined. Real. Ava had irrigation ready in her left hand before the word left his mouth. "Irrigation." She gave it. Suction already in her right. The room shifted from routine to careful. The infection had reached further than the earlier scan promised. Kane's voice clipped faster. "Large retractor." Ava handed him a smaller Richardson. Small first, less tissue trauma for visualization. He stared for a second, then took it. The smaller blade opened the angle he needed. Nina leaned closer to the field. She watched Ava's fingers. No fumble, no noise. When closure started, Ava had the needle threaded in the exact arc Kane always grabbed first. He took it without comment. By 3:29 p.m., the patient was settled in recovery. Prognosis clean, no complications. Gloves snapped into the biohazard bin. Kane looked at Ava for a long moment. Lucky instinct. "Training. Do not expect praise for doing your job." "I do not." He left. The residents followed. Nina lingered. "Where did you train?" she asked. Ava wiped the instrument tray, here and there. "That is not an answer. It is the one I have." Nina nodded once and stepped out. Alone at the scrub sink, Ava turned the water hot and watched it sheet off her hands. The steel faucet warped her reflection into a small oval. She rolled her sleeve, looked at the thin scar, pale across her forearm, then pulled the fabric back down. The smell of antiseptic felt heavy in her throat. At 4:10 p.m., Ava logged notes at the nurse's station. The pen moved in tiny blocks, no wasted loops. The building sighed. Somewhere a printer chattered and stopped. In the break room, microwaves hummed. Coffee sat on a warmer a shade too long. Miles and Leah, a first year still learning to hide nerves, leaned over a table with a view of the parking lot. Nina stirred sugar into a paper cup, listening. I am telling you, Tit, Miles said, voice low. She had irrigation ready before he saw the abscess. Maybe she got lucky, Leah said. No one gets that lucky, Nina said without turning. She reads tissue. Miles leaned back, balancing on two chair legs. Or she watches a lot of videos. You can learn anything online. You do not learn to tie like that from videos, Nina said. Ava walked in for water. She filled her mug quiet back to them. No pause, no glance. She left. The door side shut. Silence held for a beat. Did she hear us? Leah whispered. Probably, Nina said. I do not think she cares. At 4:47 p.m., the call came from the surgical floor. Second case. Assigned nurse sick. Ava was the replacement. Pre-op bay glowed soft and artificial. On the monitor, gallbladder images hovered gray on gray. Kane stood with two techs. One of them, Elena Ruiz, wore a badge that still had Army Medic in the small print. She watched Ava's hands arrange sutures and drapes the way the ends of the threads lay in neat rows like they had been measured. You were in OR3 earlier, Elena said softly. Yes. I heard you called the abscess before he saw it. I suggested imaging, Ava said. He did not take the suggestion. But you were right. It matters that the patient walks out. Elena nodded once. Fair. At 5:15 p.m., anesthesia confirmed sedation. Kane made a small clean cut and went in with a scope. Ava handed instrument for instrument in an unbroken rhythm. Trocar. Camera. Grasper. The field opened on the screen like a small theater. The bile duct sat there calm. Only there was a bump near the junction barely visible. A bulge that pulled the duct a millimeter out of true. Doctor, Ava said, common bile duct. There is a dilation near the junction. Kane did not pause. Vitals are stable. Gallbladder is clear. If there is a stone lodged in the duct, a post-op obstruction can occur. I can see the field. His voice firmed. This is my room. You assist. Clear. 30 seconds later, when he clamped the cystic duct, a small stone rolled into view as if it had been waiting behind the gallbladder wall. Kane froze. Elena's eyes went to Ava. Ava's face did not change. She placed the grasper in Kane's palm. He retrieved the stone and finished in silence. The clock hit 6:02. The monitors ticked along in polite beeps, gloves off. The air tasted of cautery and plastic. In the cleanup, Elena stayed behind. You saw that stone before he did. It does not matter. It does if it avoids a blockage. He got it out. The patient is fine. You do not get angry, do you? Anger does not save lives. Elena gave a small smile. No, but it makes you human. I am human enough. At 6:20 p.m., the hallway outside the surgical wing stretched long and white. Ava stood with a paper cup, watched it collapse under her fingers when she finished drinking. She did not throw it away. She flattened it, then dropped it into the bin. Nina passed, then stopped. You were right again. It does not feel like it. Kane is not a bad surgeon, Nina said, lowering her voice. He grew up in a time where nurses stayed in lanes and attendings did not get questioned. He does not know what to do with someone like you, someone like me, someone who sees things he misses. Ava said nothing. She rolled her sleeve up a finger width, then down again. Lights buzzed overhead. Shoes squeaked on polished floor somewhere past the corner. At 6:38 p.m., the overhead speakers cracked then cleared. The hospital shifted. A tone sounded flat and bright. Trauma alert, the intercom said. Multiple casualties inbound, all available staff to the emergency department. Ava turned toward the double doors. The sound of sirens, faint at first, rose through the windows and glass. Beep, beep. Somewhere a monitor kept time. The doors to the emergency department slid open on a blast of cold air and sirens. Nurses moved at a run. Plastic curtains lifted in the wake of gurneys. The smell hit first metal and bleach and something sweet from the cafeteria that had no place here. Kane stood at the center voice, clear over the noise. Patel, you are with me on 1. Miles, take 4. Leah, 3. Collins, bed 2. Stable. Keep them calm. Ava nodded and stepped to bed 2 as the first stretcher came through. A woman in her 40s clutched her forearm with her other hand. Her face had gone paper white. The bone looked wrong beneath the skin 2 inches above the wrist. The monitor picked up with a steady chirp. Heart rate too fast, pressure a little high, breathing shallow with fear. I am Ava, she said, sliding a cuff over the woman's arm. You are safe. We will control the pain. It hurts, the woman said, teeth-clenched eyes flicking toward the other beds, as if pain could be outrun. We will handle it. Ava found a vein and advanced the catheter in one smooth move. Tape. Saline. She set a hand on the woman's shoulder and felt the tremor part shock, part adrenaline. Behind her, the room swelled with bodies and sound. Paramedics called vitals as if they were throwing lines from a boat. Patel cut away a shirt at bed 1. Kane leaned over a chest that did not move evenly. A teenage boy on bed 4 bled through gauze at the scalp. Leah tried to get a clear response from a woman who would not answer questions. Ava adjusted the flow on the IV. She turned her head to listen. The room has a way of talking if you let it. Beeps stack into patterns. Air squeezes through plastic and hisses. Somewhere a printer stuttered and stopped. A sound cut through it. A high, wet whistle just out of sync with breath. Not the soft seal of a mask. Not the rattle of sputum. Higher, sharper. She looked over bed 1. Man in his 60s. Shirt gone. Bruise blooming under the left clavicle. Jugulars full. The skin at the neck moved wrong, a small puff with every attempt to pull air. Saturation fell faster than fear could mask. 92. 89. Ava said to her patient, I will be right here, then took 2 steps toward bed 1. Doctor. Kane did not look up. Not now, Collins. The sound is tracheal, airway is compromised. We are placing a chest tube, he said. Return to your patient. 86. The man's lips were sliding toward blue. Patel squeezed the bag. The chest rose a little and fell too slow. The whistle tightened like air forced through a crack in glass. If there is a fracture at the trachea, you are not moving air, Ava said. If you place the tube first, you are wasting time. Kane lifted his head. His eyes were hard, but his hand paused over the tray. You assist. You do not diagnose. Bed 2 is your assignment. Understood, she said. She did not move back. 83. The monitor pitched into alarm. The man's eyes rolled toward white. Patel tried to ventilate again. The bag met resistance that did not give. She shook her head. I cannot move air. Kane reached for the intubation kit. Laryngoscope. Patel brought it. The man's jaw was slack, but the view down did not open the way it should. Blood in the oropharynx, a cartilage line out of place. Stop, Ava said. Kane snapped out. He is going to code. He has a collapsed lung and I'm treating it. He has a fractured trachea, Ava said. She stepped to the head of the bed and placed her fingertips on the man's neck. You are killing him. The room went silent as if someone had pulled the plug on the noise. Even the rhythm of beeps seemed to wait. Security, Kane said. No. Ava did not look at him. She found the notch above the cricoid with her fingers. The membrane felt thin under the pad of her index. She picked up a scalpel from the instrument tray. It sat light in her gloved handblade, reflecting the lights. Reed Kane started the wrong name from a memory he did not have. Ava made a horizontal incision 1/2 inch long. Skin soft tissue, the fast give of membrane. Blood welled not much. She slid a bougie, felt the tip push into a space that wanted to take it. Tube followed the path. Cuff, syringe. Patel connected the bag and squeezed. The chest rose. The whistle vanished. The monitor started climbing like a person finding a staircase in the dark. 78, 82, 87, 92. Patel stared. Air's moving. Elena Ruiz had appeared at the foot of the bed without anyone calling her. She watched Ava's hands finish the tie and secure the tube. Field airway, Elena said under her breath. That was clean. Kane's face lost color, then found it again in a flood. Get out, he said. You are suspended, effective now. Ava set the scalpel on the tray. She looked at the man's chest. Rise, fall. She looked at the monitor. The numbers settled in a narrow, stubborn range. Then she turned to Kane. He is breathing. You performed a procedure you are not credentialed for. You disobeyed a direct order from the attending. Leave the department. Do not speak to any more patients. Ava peeled off her gloves and dropped them into the red bin. The latex snapped on the way down. She said nothing. She stepped backward once to give Patel room, and then she walked around the edge of the room. No one reached for her. No one stepped in her way. She hit the sensor and the doors opened to the hall. The hallway felt too bright after the chaotic dark of trauma. Her ears still held the pitch of the alarm. She walked past a window that showed the gray of evening. A security guard turned his head as she passed and then looked away. In the locker area, she washed her hands for longer than needed. Hot water. Soap that smelled like citrus left in the sun. When she rolled her sleeve up to dry, the thin scar across her forearm flashed pale, straight, precise. She pulled the fabric down. Her phone buzzed. Unknown number. She let it go dark. It buzzed again and she slid it into her pocket. Outside, the parking lot glowed under sodium lights. Cars sat in rows like quiet animals. The air held the taste of exhaust and early night. Ava stood beside her car with her keys in her fist and listened. The hospital's hum traveled out through the walls. Behind her, the doors pushed open and Nina stepped out in a disposable gown, hair tucked behind her ears. She jogged to close the distance and stopped a few feet away to let the urgency fall off her. "You cannot just leave," Nina said, breath still fast, eyes steady. "I was told to leave." "I looked you up," Nina said. "The file is a line and a license. No history before Bayview. That is not possible, not for hands like yours." Ava watched the lights change on the face of a car as it turned out to the street. "It is enough." "It is not," Nina said. She lowered her voice. "Elena thinks you were Army. She watched your tie in OR. She was in too. She knows the moves." Ava turned her head. Elena had come to the doorway and now stood with one hand on the frame. She did not step out. She did not look away either. "You heard me?" Nina said softer. "You were right on the abscess. You were right on the stone. You were right on that airway." Ava closed her fingers around the keys until the edges pressed half moons into her palm. "It matters that the patient is still breathing. That is the only part that matters." "It also matters who made that happen," Nina said. "I do not want it to matter." Her phone buzzed again. She pulled it out without looking at the screen and muted it. The vibration went quiet. The intercom inside the building clicked. The sound was thin through the glass and then clear in the open as the speakers picked up across the campus. A tone sounded. It did not carry words at first. It was a call that the body recognizes before the brain does. "Trauma alert," the voice said. "Mass casualty incident. Multiple vehicles, all available staff to the emergency department." Nina's head turned toward the doors. Elena's hand tightened on the frame. Ava felt her pulse in the hand that held the keys. She put the phone back in her pocket. She did not move. She breathed in through her nose and out through her mouth and watched her breath ghost the air. Sirens found a new note as they came closer. Somewhere inside a monitor kept time. Beep, beep, steady. Ava walked back through the sliding doors as the first ambulance hit the bay. The sirens folded into the white light of the room. Stretchers rolled in two at a time. Voices stacked and overlapped. The curtains lifted and dropped like lungs. Kane planted himself in the center. He pointed without looking away from the incoming line. "Patel bed 1, Leah bed 3, Miles bed 4, Ruiz float, Collins bed 5, minor. Keep them stable." Ava moved to bed 5. A young man stared at the ceiling with his mouth open, air coming fast and shallow. Lacerations striped his forearms and cheek. Blood made a slick ladder down his wrist. She checked airway breathing circulation. Airway clear, breathing rapid but even. Radial pulse quick under her fingers. She spoke low. "I am Ava. You are safe." He nodded once. His jaw shook anyway. She cleaned the worst cut and pressed gauze into his palm. "Hold this, hard." At bed 1, Patel cut away a soaked shirt. The man beneath it breathed like something had stepped on his chest. Kane pressed a stethoscope to the ribs and frowned. A paramedic called over the rail breath short from the run. Found him under the passenger side. Seat collapsed, left side quiet. "Tube kit, yep," P.S. Kane said. A second stretcher snapped into bed 3. Leah tried to assess lips moving in a pattern she had practiced. The woman on the bed did not answer. Blood turned her hair to a dark cap. The third stretcher held an older man with a belly that bulged and did not relax. He moaned and tried to sit. Miles pushed him back with a hand on the sternum and glanced at the screen for numbers that did not comfort him. Ava taped the young man's gauze and drew a line of lidocaine for the deeper cut. His breathing slowed with the sting. She felt the room again. Hiss, beep, metal, the soft whine of a warming cabinet. She let the noise order itself in her head so that the wrong sound would stand out. It did. From bed 1, the whistle had vanished. The bag at the head of the bed met less resistance now that air found the trachea from earlier. Patel nodded. Good chest rise. More stretchers arrived. A woman in her 50s with ribs moving out of sequence. A teenage boy with a tourniquet high on his thigh and a look that said he did not yet know what had happened to him. Elena Ruiz slid between beds and made IVs appear where earlier there had been nothing but cold skin. Then 2 more gurneys turned the corner at speed. The first carried a woman in her 40s with a flail segment that lifted wrong. The second carried a man in dress greens. Silver eagles at the collar flashed under the lights. His skin had the gray of paper. His eyes were closed. The paramedic spoke while they moved. Colonel David Harlan, 5'9", witnessed a crash, collapsed on scene, CPR in the field. We had a pulse and lost it. Pressure low, muffled heart sounds, neck veins full. Kane pointed. Bed 8 for the colonel, bed 7 for the chest wall. Patel stay on 1, Miles take 8 with me, Ruiz echo. Ava looked at her patient. The cuts were clean and controlled. His monitor had calmed to a nervous steady. She squeezed his shoulder and let go. She stepped to bed 8 as they transferred the colonel. The man looked smaller without the uniform holding him together. His breath came shallow and hard. The cuffs searched for pressure and found almost none. 70 over 40. The monitor counted a heart that ran too fast for how little work each beat did. I need the ultrasound, Kane said. Elena brought the machine and gel. He pressed the probe below the sternum and angled it toward the heart. On the screen, a dark crescent hugged the beating muscle. The heart twitched inside a shadow like a fish in a net. Pericardial effusion, Miles said. Tamponade, Kane said. Pericardiocentesis kit. A nurse opened the sterile tray. The syringe gleamed with its long needle. Kane grounded himself with his heels and lifted his chin. He set the point below the sternum and started to angle toward the left shoulder. His hand trembled. Not enough to advertise. Enough for the needle to know. Ava watched his wrist. She watched the screen and the numbers and the move from careful into hurried. She spoke without raising her voice. 5th space, 30 degrees left of the sternum is safer here. Kane did not look up. I know the anatomy. He advanced. The monitor screamed. The line that should have jagged settled into a thin strip. The colonel's body did not move. Kane pulled back. Sweat stood on his lip. He adjusted the angle and tried again. The same noise answered him long and bright. Stop, Ava said. Do not speak, Kane said. His voice was hoarse. He looked at the screen as if he could make the heart obey by will. The heart skittered and then fell away. The monitor sank to a line that did not tell a story. Patel looked over from bed 1. Miles froze. Elena held her breath. Code, someone said barely above a whisper. We are coding. Ava moved. She did not ask. She placed her fingers on ribs and counted to the 5th space along the left sternal border. She found the small slip between bones that had just enough give. She took the needle and syringe into her hand. Her fingers settled. The room dropped into a tight circle of light. Security, Kane said. It came out like an echo. No one turned. Ava aimed 30 degrees toward the left shoulder and advanced. The needle pushed through skin, through muscle, through the stubborn spring of cartilage. She felt resistance change from heavy to light. The plunger drew back. Dark blood filled the barrel. 10 milliliters, 20, 30, 40. She withdrew and set the syringe aside. Bag, she said. Elena already had it. She placed the mask and squeezed. The chest rose a little. Ava put both hands on the sternum and began compressions, hard and fast. The bed shook with the rhythm. A nurse counted under her breath. 1, 2, 3. The clock on the wall did not care. It ticked. Patel stood at the foot and watched with a focus that canceled the rest of the room. Miles snapped a line open for epinephrine. The smell of plastic and sweat and a hint of burnt fiber from the defib pads in their wrapper mixed into something that lived in trauma rooms everywhere. 2 minutes. The line stayed flat. Ava kept the depth and rate. Her shoulders did not hitch. Her breath set itself to the work. Elena squeezed the bag in time with the count. 4 minutes. A nurse pushed epinephrine. Ava did not look up. She set heel to bone and let the sternum spring back each time. The sound of skin under glove found a rhythm of its own. The face on the bed did not change. 8 minutes. Kane stood with his arms hanging and his mouth open. He closed it. He opened it again. He did not say anything. Nina appeared at the edge of the curtain, eyes on the monitor, then on Ava's hands, then on the colonel's face. 10 minutes. Miles looked at the clock and then at Ava. We are past 10. Ava did not answer. Elena kept the bag steady and her jaw tight. The colonel's chest took the breaths they gave him and did not offer any back. 12 minutes. The room had gone quiet except for the count and the hiss and the small sounds bodies make when they are asked for more than they want to give. Ava's palms burned. She did not change pace. 13 minutes. Patel spoke without moving her eyes from the screen. Depth is perfect. Do not stop. Ava pressed and pressed again. The line on the screen shivered. No one spoke for a breath that felt longer than a breath should be. 14 minutes. Ava paused for 2 beats. Elena gave 2 breaths. Ava reached to the neck and laid her fingers on the carotid. Nothing. She set her hands again. Come on, she said to a man who could not hear. Not yet. She counted out loud. 1, 2, 3. A dot appeared on the monitor, small and out of place. It came again. Then the line found the shape it had forgotten. Weak, erratic, real. I have a pulse, Elena said. Her voice jumped an octave. I feel it. Ava lifted her hands and went to the wrist, and then the neck again. A thread beat there. She nodded once. Start a presser, titrate to a map that makes sense. Keep the airway, get cardiology down here and call CT, head and chest. People moved as if they had been released. Elena turned the bag and eased back as the colonel tried a breath on his own. It rattled, but it moved air. Miles found the medication and let it run. Patel put a hand to her chest and then dropped it, embarrassed by the impulse. Kane stared at the monitor. He looked older by 10 years. His gloves hung at his wrists. He tried to speak and nothing arrived. He tried again. You brought him back. Ava checked a pupil response with a penlight. The pupils tracked slow and sluggish, then tightened. She adjusted the mask seal, and the line on the monitor settled into an ugly rhythm that still meant life. He was not gone, she said. Elena met her eyes. You have done that before. Ava did not answer. She pressed the tape on the IV and checked the pressure again. Numbers that had been thin now thickened notch by notch. The colonel's eyelids moved. They lifted a fifth of the way, then a little more. He looked unfocused and then found a shape above him. His lips worked. A sound came that did not have a word yet. Elena bent close to listen. A nurse arrived with a transport order. Cardiology called in that they were on their way. The room began to breathe like a chest that had finally cleared a blockage. Ava peeled off her gloves and threw them into the bin. The latex made a soft smack against red plastic. She stood back from the bed and let the team fill the space she had held. Kane stepped to her, then stopped as if he had reached the edge of something he did not trust himself to cross. Collins, he said. The name sat between gratitude and a reprimand that had lost its teeth. He let the rest disappear. Ava took one last look at the colonel. The monitor held a rhythm that did not apologize. She turned and walked out through the curtain. The room noise dropped one layer as the fabric fell back into place. In the hall, the lights hummed. The air felt cooler. She leaned a hand on the rail and let her shoulders fall once. Her phone buzzed in her pocket. She pulled it out. Unknown number again. She watched the screen until it stopped and went black. The smell of antiseptic traveled with her as she started down the corridor. The hall bled the noise out of her. Ava walked until the hum settled and found a side corridor with a bench under a framed print of the harbor. The glass held a reflection of her face that looked thinner than she felt. She sat and let her hands rest on her knees until the pulse in her palms slowed. Nina found her there. She did not sit right away. She stood close enough to talk without being heard beyond the two of them. Her voice stayed low. You saved him. Ava looked at the scuffed floor. He has a rhythm. That did not come from luck. Footsteps approached. Elena Ruiz stepped around the corner with her badge clipped at an angle and a phone already open to a document. She glanced once to make sure they were alone, then turned the screen so it faced Ava. I dug, Elena said. I had to. This was declassified 3 months ago. It was buried. On the screen lines of text under the header from a field hospital in Helmand. Ava took the phone. The words were clinical and dry in a way that carried weight anyway. 2 contractors had arrived in shock with traumatic amputations and no distal pulses. Blood loss over 60% at arrival. Classified as non-viable. Triage diverted to 3 local children with penetrating shrapnel injuries and airway compromise predicted survival high with immediate intervention. Ava's grip tightened. The edges of the case pressed into her fingers. The hallway lights hummed like insects. They told me I failed them, she said. The sentences came slow. They said I chose wrong. You chose the only path that led to survival for anyone, Elena said. The report says that plain. Nina's eyes stayed on Ava's face. You were not in the system before Bayview. You changed your name. Ava looked up. My license is mine. The rest is paperwork. Collins is clean. And your name, Nina said, careful with the syllables, was Mercer. Ava handed the phone back. The thin scar on her forearm paled as the skin stretched. It still is inside my head. They stood with the breath between them carefully measured. The door at the end of the corridor opened and closed. Dr. Richard Kane came into view. He had taken off his cap. Without it, the gray at his temples showed like frost. He stopped a few steps away. For a moment, he did not seem to know where to place his hands. He settled for his pockets and then pulled them out again. I owe you, he said. The words did not fight. More than an apology. He looked at Nina and Elena, then back to Ava. I served once. Germany. I wore the uniform. I tell people I was in the Corps. It sounds like I earned certain stories. I did not. I never saw what you saw. When I watch your hands, I see what I pretended to be. It made me small, and I treated you smaller to match it. Nina watched the floor. Elena watched his face. I suspended you because I could, Kane said. It felt like control. It was fear. Ava did not move. The corridor held the faint smell of disinfectant and warm air from the vents. She said nothing. Kane took a breath that sounded like it hurt. The hospital will offer you a physician contract. I will ask them to. I will step aside if that is what it takes. We need you where your hands belong. The title is not the point, Ava said. Her voice did not rise or fall. If I stay, it is to build something, a program, combat skills translated to civilian rooms, pericardiocentesis on a simulator until the hand knows the geometry without the head, emergency airway, needle decompression, massive transfusion, teach residents, nurses, medics, anyone who will show up. Kane nodded before she finished. Yes, Elena goes to medical school, Ava said. She has the instinct and the hours. She gets backing. Elena blinked. She had not expected to be part of the terms. Kane looked at her as if seeing her for the first time. Done, he said. A tone cut the corridor from the ceiling speakers. It was short and sharp and made the hair on Ava's arms lift. Code and trauma, the intercom said. Bed 8. They were moving before the rest of the line finished. The hall narrowed and then opened on the bay. The curtain at bed 8 had been pulled, and the room was a bright box of hands and equipment and sound. The colonel lay under pads that showed a sheen of gel. His body jumped under a shock that did not correct anything. The monitor traced a chaos that had no pattern. Charge to 200, a nurse called. Clear, Patel said. The shock lifted the chest and set it down. The line on the screen skittered and then returned to the same storm. Elena handed over a syringe. Epinephrine in. How long? Ava said. 3 minutes in ventricular fibrillation, Patel said. Her voice had the thin edge of someone forcing it flat. Amiodarone, Ava said. 300 milligrams. Push now. Kane hesitated, then reached for the vial. His finger slipped on the plastic. Elena had already cracked one and pushed it into Ava's hand. Ava connected the syringe and pushed. The medication slid into the line with a cold certainty. Charge to 300, Ava said. On me. The paddles felt heavier than they looked. Ava placed one below the right clavicle and one at the left lateral chest. She checked for contact. She looked at faces and saw them pull back without being told. Clear. Her thumbs pressed the buttons. The colonel arched. The monitor went still for a count of 2. A blip stood up. Another followed. The quake on the line straightened into a rhythm that a body can use. Patel let out a breath that sounded like a laugh and a sob at the same time. Sinus rhythm. Elena leaned close to the colonel's face. Sir, can you hear me? His eyelids fluttered. He found the ceiling and then the shape of Elena's eyes. His lips moved. The word did not carry. Stay with us, Elena said. You are safe. Numbers began to shift into better places. Pressors ran and eased. The air around the bed lost a layer of tension. The smell of ozone from the shocks hung thin in the room. Kane looked at the screen and then down. He took off his gloves and tossed them. They missed the bin and hit the floor. He did not pick them up. He looked at Ava. Dr. Collins, Ishard, he said. The word doctor sat there without challenge, or Mercer. Ava glanced at the colonel. His breath came with effort that made sense. The beep landed on a steady mark that felt honest. Mercer is fine, she said. Kane shook his head once as if clearing water from his ears. Stay, not as a nurse, as trauma. Lead it. Set the standard. Build what you spoke about. A nurse came to the edge of the group with a transport slip. Cardiology called in from the elevator. Patel adjusted a clamp and checked a line with the back of her hand like she was feeling a child's forehead. Ava looked at Elena. Elena's mouth had found a line that was not quite a smile and not quite something else. She held the bag for a few more breaths and then eased back to let the colonel try his own. Ava turned to Kane. "I will think." He nodded and did not press. He stepped away to let a tech through. Nina appeared at Ava's shoulder with the look of someone who had already started thinking 2 steps past this moment and had stopped herself. Ava stepped out of the way of the transport team. The wheels clicked on the floor seams. The curtain swung once and settled. The tone overhead changed back to the soft cycle of standard calls. In the glass of a cabinet, Ava caught the small distortion of her own face and the straight line of the scar when she pushed her sleeve to wash her hands. The water ran hot. The sound of it hid the room for a few seconds, then let it in again. The monitor in bed 8 kept time. Beep, beep, steady. 3 months later, the conference room at Bayview felt too small for the bodies inside it. Chairs lined the walls. People stood too deep at the back. The projector washed the front with white light. On the first slide, a title held steady. Combat Medicine for Civilian Rooms Instructor, Dr. Ava Mercer. Ava faced the crowd in scrubs and a white coat with her name stitched clean, hair pulled back, hands quiet at her sides. The room carried a faint mix of coffee and dry erase marker and the metallic scent of equipment carts waiting in the hall. "Good morning, Wiki-Sam," Jewish said. "We will work with our hands today. Needle tube pressure angle. We will repeat until your hands know it without your head telling them." She clicked to a diagram of a chest. Landmarks glowed in simple lines. Ribs counted off their spaces along the sternum. Pericardiocentesis first. Left of the sternum at the 5th space. 30 degrees to the left shoulder. You feel a change when you enter the sac. You do not force it. You let anatomy tell you where you are. Nina stood at the wall with a clipboard. Dr. Richard Kane took a seat in the back row and said nothing. He had a pen in his hand and never used it. Elena Ruiz wore a short white coat with a badge that read medical student and a strip of tape that read teaching assistant in block letters. She set a simulator on a table and tapped the plastic chest with her knuckles. "Station's open, okay," Ava said. "Rotate every 20 minutes. Ask questions in the room, not in your head." The first resident at the pericardial station lifted a needle and froze halfway in the air. The simulator had the quiet menace of real procedure. Ava moved beside him. She placed her hand on his wrist and guided the point to a line on the skin. "Find the space she's told. Beyond space," she said. "Count ribs. Feel the notch. Now angle. 30 degrees. Slow pressure. Focus on resistance. Stop when it changes." He advanced with breath held. The plunger eased back. The syringe filled with dark fluid. A small beep from the simulator confirmed an entry. He exhaled and laughed once, surprised at the sound. "Again," Ava said. "Repeat until the line in your head is straight." At another table, a nurse struggled with the cricothyrotomy model. The scalpel trembled over a square of synthetic skin. The lights hummed. The hallway noise faded to a low band. "Breathe," Ava said, kneeling to be level with her eyes. "Locate the cricothyroid membrane, mark it with your fingertip. Small horizontal cut, 2 layers. Insert the bougie. Do not rush the tube. You are in control." The knife made a neat line. The bougie slid. The tube followed. The cuff inflated with a soft squeeze that felt like certainty. "Good," Ava said. "Again." At the chest tube station, Elena ran a small group through landmarks in motion. Her voice was steady and patient. Mid-axillary line at the 5th space. Track along the top of the rib to avoid the bundle. Feel for ribs, not the idea of ribs. Guide with your finger. Tunnel then tube. She watched hands work and corrected without heat. When someone asked how she knew when to stop, she tapped the back of her own hand. "Your fingertips will tell you when you are where you belong." FEMA observers stood near the door with notepads they did not use. A man in a suit coughed into his fist at the wrong time. No one turned. Ava moved between stations like a metronome for the room. She fixed a grip here and a wrist there. She asked short questions and waited. She used the phrase slow pressure more than once. She tapped the edge of a table when someone rushed for a result. The motif in the room was simple. Beep from a simulator, squeak of a shoe, the small sound of breath when someone did something right for the first time. In the break between stations, Kane stepped up to her and stood off to one side to avoid creating a circle. Your room, he said. Imam, he said. Your rules. Administration is happy. I am too. Ava nodded. Thank you for not saying more. He smiled without showing teeth. You trained me today, too, he said, and moved away. After the session, the crowd thinned. People queued to sign up for the next block. Elena broke down equipment and stacked empty cases like puzzle pieces. Nina set a sign-in sheet on the table and lined up pens so they pointed the same way. That went fast, Elena said. It should not feel fast, Ava said. It should feel exact. Elena lifted a case and hesitated. I got the email. Ava looked up. Acceptance with scholarship, Elena said. She made it sound like a line in a chart note. Her eyes did not match her voice. I start in the fall. Ava took in the way Elena held the news. You will be good in a coat, she said. Elena let her mouth find a real smile. You already knew. Yes. The recovery wing smelled softer than the ER, warmer air. The beep of monitors toned down to a polite presence. Colonel David Harlan sat in a chair beside his bed. He wore a hospital gown and a blanket over his knees. Color had returned to his face. His daughter sat with him. One held a paper cup and two held each of his hands. He saw Ava at the door and lifted a palm in greeting. Doctor, he said. His voice had found its weight again. Ava stepped inside. The daughter stood. The oldest introduced herself as Rebecca. The other two smiled with the trained grace of people who had had long days turn out in a way they could live with. Thank you, Rebecca said. She said it once and then again, as if the second time would reach deeper. He did the work, Ava said. We gave him a chance to do it. The colonel patted his pocket and brought out a photograph. 5 grandchildren in a loose cluster around a dog that looked like it had more sense than most people. I owe them a summer, he said. You bought time. I know what that costs. Ava held the photograph for a breath. The corners were scuffed. The faces were open. She handed it back. Take them fishing, she said. He laughed once. Plan to. On her way out, her phone vibrated in her coat. The number showed as unknown, and she answered anyway. A line clicked and found a voice she had not heard in a long time. Mercer, the man said. David Chen. Former. I heard you are back in the room. Ava leaned a shoulder to the wall and let the phone rest against her cheek. Sir? You made the right call in Helmand, Gia, he said. Nobody said it then. I am saying it now. The paper caught up, and so did the people who needed to. Keep your hands where they are. Thank you, Ava said. She let the silence sit long enough to be its own kind of message. Then she ended the call. In the chapel, stained glass filtered outside light into soft color. The air was cool. Ava sat in the back pew with her elbows on her knees and let the stillness settle like a sheet. She did not pray. She counted breaths without counting out loud. The line of her scar stood pale where her sleeve had ridden up, straight, precise. The shape of a decision you can live with. The intercom clicked. A standard tone sounded. The voice that followed was clear. Dr. Mercer to Trauma 1. She stood, and the sound of the door was gentle behind her. The hall hummed. She passed a window that showed the city and a sliver of water and cars stacked at a light. The trauma bay opened like a stage when the curtain goes up. The smell of iodine and warm plastic met her. Elena was at the head of the bed with a mask ready. Nina checked a line and looked up when Ava entered. Kane stood slightly back, eyes on the monitor, hands still. Ava pulled gloves from a box. The powder smell rose as she snapped them on. She took her place at the foot of the bed and laid a palm on the sternum to feel the heat of a living chest. We go on my count, she said. By my count, she said. The team found the rhythm that had become familiar in the months since she had brought it here. Instruments sat in a line like notes on a staff. The angles in the room all pointed toward the center of the work. Ava looked at the monitor. The graph flicked. The sound that ran the building lifted and fell and came back to the same place. Beep, beep, steady. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.